we're going to talk about psychological disorders. Everybody has struggles. Sometimes those everyday problems or struggles become problematic enough where they reach the threshold of being a psychological disorder. So what are psychological disorders? Well, they're a constellation of symptoms that create distress for the individual, or they impair work and school and your relationships or your ability to kind of live, take care of yourself, or they can lead to significant risk or harm to yourself or to others. Oftentimes there's cognitive symptoms, emotional symptoms, and behavioral symptoms. About 20% of people have a disorder in any given year, so that's a fair amount. And almost 50% of people will have a disorder sometime during their life. So it's pretty common to struggle with psychological issues to the point where they reach a threshold of being a disorder. Sometimes the terms abnormal and insanity are kind of used interchangeably with psychological disorder, but they're really a little bit different, especially insanity. Now, insanity is a legal term, and it means being unable to appreciate the nature and quality of the wrongfulness of your act because of mental disease or defect. So it just means you couldn't appreciate what you were doing was wrong, even. Or abnormal is just a condition or behavior that deviates from the usual physical or psychological state. It's abnormal. And again, when we're thinking about this, culture and context are important in defining what's abnormal. What's abnormal in one culture may not be abnormal in another culture. Talking to the dead may be normal in some cultures, not here, and so you always have to take that into consideration. Then of course there's a lot of disagreement about what is actually normal or kind of pathological behavior. Now, I think we have again kind of a more biopsychosocial model. In the past, when mental illness wasn't really understood, it was viewed as demonic possession. Today we know it's much more involved than that. Certainly the brain is involved, genes and neurotransmitters and the brain structure and function. And there's this kind of diathesis that usually implies that we have some sort of vulnerability that, when triggered by stress, can result in mental illness or psychopathology. There's definitely, at the kind of level of the person, there's learning, classical and operant conditioning. Certainly classical conditioning learned about with phobia, different cognitive biases of interpreting the world and emotions, some extreme emotions, fear and anxiety, sadness, anger, so on. And then the group, as well has a tremendous impact. One, not just on the conception of the disorders, as we said, some of these are kind of culturally influenced or culturally bound, but our relationships with people can sometimes make certain illnesses worse or make us more likely to relapse, and the social support that people provide us really can help us cope with disorders. Now the manual that's used to diagnose people has recently come out. It's the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, and it typically, we'll kind of talk about this, but there's a bunch of Axis 1 kind of clinical disorders, then Axis 2 personality disorders and things like mental retardation, and then some general medical conditions and these kind of psychosocial and environmental problems, and then like a global assessment. This book is based on the DSM-4. There are some changes in the DSM-5, our textbook. So, but what I'm going to be talking about is going to be consistent with your textbook, the DSM-4, so as not to confuse anything. Mood disorders are probably among the most common. These persistent or episodic disturbances in emotion that interfere with your normal functioning. And again, major depression is one of the most common. It affects your affect, your behavior, your cognition. It's probably the single most, or it says here, the most common psychological disorder in the United States, and it's about twice as common in women than it is men. Again, I guess some of the symptoms just, you feel worthless and guilty, and you may lose your appetite, you can't sleep, you may be suicidal, you have low energy. All these things are sort of symptoms of depression. You can find this in the book. There's a more kind of chronic, lower intensity depression called dysthymia. Lifetime prevalence about 6%, and suicide, real common among depressed people. About 30% may attempt suicide when they're depressed. So suicide is a real serious risk if somebody's depressed. Another mood disorder, bipolar, is one where you have some of the depressive symptoms, or you have the depressive disorder, and also sometimes you swing into these kind of manic modes, these super highs where your mind is racing and you're talking fast and you can't sit still, and oftentimes you're agitated and sometimes often elated, very buying sprees, and you start companies and you gamble away your money and have sex with random people, and so it can be really kind of destructive. And then if you get too manic, you get really just almost kind of confused and psychotic and agitated. Hypomania, there's some hypomania, which is not quite as intense as the manic phase. And then there's some prodromal phases, where you normally have some kind of indication that you may be moving in or out of into a manic phase or a depressive phase. Again, there's often these cycles with depression. It was formerly called manic depressive disorder. Lifetime prevalence 1%. It can be pretty serious, very debilitating. And oftentimes people, it takes a while to get them to convince them that to take their medicine regularly and whatnot. Mood disorders have a variety of factors. It definitely runs in families, and serotonin has been implicated, as we talked about. Some of the popular drugs, the serotonin reuptake inhibitors. At again the level of the person, there seems to be this Beck's negative triad is this negative view of the self, a negative view of the world, a negative view of the future, and everything is negative. This maybe learned helplessness, you feel like you can't do anything, or you may have a real depressive attributional style where you take responsibility for bad things and think it reflects you as a person, and it'll always reflect you as a person. Well, certainly, as we talked about, life stressors and social relationships can be either sources of support and reinforcement, or some relationships can be real damaging. Anxiety disorders are the biggest class, so you put all the different types of anxiety disorders, and it's going to be the most significant class, even though depression was the most significant diagnosis. One common one, generalized anxiety disorder, is this kind of pattern of frequent, constant worry and anxiety over many different activities and events. So this is almost like a chronic worry, but you're really kind of keyed up. There's a lot of physiological anxiety-related symptoms associated with it. It's panic disorder. These are these kind of severe anxiety attacks that come out of nowhere. You feel like you're going to die. In fact, a lot of these people end up in the hospital. They go to the emergency room because they think they're having a heart attack. These are very scary and debilitating, and sometimes they'll lead to agoraphobia, this fear of kind of going out in public for fear of having one of these panic attacks. There's certain areas of the brain, like the locus coeruleus, that is have been implicated, and these people do seem to be more sensitive to anxiety in general, anxiety words and whatnot, a hypersensitivity to being anxious. A lifetime prevalence about 3%. Phobias are pretty common. The most common is social phobia, this fear of being in public and being judged by others, about 13%. So this is really a common fear. And then a ton of specific phobias, really hundreds, probably thousands for all I know. But a lot of them are related to like animal fears or blood injection injury fears, natural environmental fears, earthquakes, situational fears, or stuff like heights or common water, those types of things. A lot of miscellaneous fears. You can be afraid of almost anything, and about 10% of the people will have a phobia. Most of the time, people can avoid what they're afraid of pretty easily, so it's not that distressing. Obsessive compulsive disorder is very serious. The obsessions are these kind of really random thoughts that you feel like you can't control. They just kind of come out of nowhere, and they're pretty nonsensical. Oftentimes people engage in certain compulsions in response to these thoughts, like I'm dirty, and I got germs on me, and so you get a lot of checking and washing or ordering things to try to reduce the anxiety. Again, lifetime prevalence 2-3%, can be very debilitating. Brain structure, the caudate nucleus, is somehow involved in this. Post-traumatic stress disorder, we most typically associate it with combat, but it can be any natural stressor. It could be an assault, rape, natural earthquake, any of those. But normally you have this traumatic event, you feel very afraid and helpless, and then you begin to kind of re-experience these symptoms, re-experience the event. You have this kind of avoidance and emotional numbness, but a heightened arousal, so you're very jumpy. Again, lifetime prevalence about 8%, at least among Americans. There is a genetic predisposition. Not everybody who experiences trauma is going to get PTSD. Schizophrenia, a real serious disorder. A few different types of it, but sometimes associated with these positive symptoms: delusions, hallucinations, disordered behavior, disorganized speech that just don't make any sense whatsoever. Or you sometimes see negative symptoms, like really flat affect, and you have a lot of this kind of alogia. They don't say much, real poverty of speech, or abolition. They don't do much. They'll just sit there. They don't initiate behavior. Again, it can be very debilitating disease, mental illness, I should say. Lifetime prevalence 1%. There's a few different types. A paranoid type, where you fear that you're being persecuted or people are after you. A disorganized type, where you just don't make any sense. Catatonic is more one where you don't move or sometimes initiate behavior, and then this kind of mixed, undifferentiated type. They're probably, even though they're all called schizophrenia, some of them are really distinct in the way they look. Again, it does run in families. The dopamine is implicated. Some of the drugs that treat the hallucinations, interfere with the dopamine antagonist. The group is an impact. If you're from a family that has this high expressed emotion, you're more likely to relapse, and there's definitely some social factors that interfere with help with either kind of cope or can interfere with your recovery or relapse from schizophrenia. This is one where you don't really often typically fully recover. There's usually some sort of residual symptoms. There's dissociative disorders, the dissociative amnesia, where you forget parts of your life, dissociative fugue, where you forget your identity, and then dissociative identity disorder, which is the old kind of multiple personality, where you have multiple personalities and within you, and it's really kind of fascinating. I think I'd read about that in the book, but you have like one dominant personality, and then you have some of these sort of other personalities that are, they're within you and they come out, but they're usually not the dominant one. The dominant one's not aware of them. It's just fascinating. There are a number of somatoform disorders. These are psychological disorders. They're physical ailments, but they don't have any organic basis, and they assume they're due to psychological factors. The first one is somatization, a history of diverse physical complaints that appear to be psychological in origin. So people always, have these vague complaints of, pain and this, that, and the other thing, but you can never find anything wrong with them. The assumption is that it's maybe some sort of channeled anxiety. Conversion disorder, where sometimes people will lose physical functioning, in an organ system. It could be blind or paralysis, and yet there's no, organic explanation for it. And then hypochondriasis, this kind of excessive preoccupation with health and worrying about developing an illness. So a hypochondriac would worry that they're going to get cancer or have AIDS, and they worry about it all the time. Eating disorders can be real dangerous. More common among women and in college samples. Just real quickly, anorexia nervosa. This idea that you're refusing really to maintain a normal weight, and you have this body image distortion where you think that you look fat. This can be real serious if people starve themselves. Bulimia nervosa is this kind of uncontrolled overeating, and then these kind of compensatory responses to deal with that overeating, throwing up, purging, laxatives. There's again some genetic predisposition here. It kind of seems to run in families, more common in women. Some cultural factors. There's really a lot of pressure on women in like American society than ideal. Lifetime prevalence about 1/2 to 4%. There are all these personality disorders, which we call their kind of axis 2. And the reason they're on their own axis is because they reflect this enduring pattern of inner experience or behavior that deviates from expectations of culture. But in other words, they're your personality. They're long-standing, but they're considered to be odd or inappropriate or dysfunctional. They can affect your cognition, your emotions, how well you're able to interact with others, your relationships with others, your ability to control your impulses. And again, I think the thing that's important to remember here is they're an enduring pattern, and that's pretty inflexible and pervasive. It's hard to change, and like personality, you see it in many situations. There are, in the DSM-4 TR here, 3 clusters. There's a paranoid that is sort of distrustful and suspicious of others. A schizoid, which is kind of detached from social relations, and they have this real restricted range of emotions. Schizotypal, which is, again, a discomfort with close relationships, but it's more these odd cognitive and perceptual distortions and eccentricities. It's almost like schizophrenia, but not quite there. There's these cluster Bs, which they say, people often appear, dramatic, emotional, erratic. Antisocial are people who have this is the old sociopath or psychopath, disregard and frequent violation of the rights of others, little guilt, taking advantage of people, can be aggressive. And borderline, real serious, this instability of interpersonal relationships and self-image, emotions, and control over your impulses. Histrionic, just being real kind of excessively emotional and attention-seeking, kind of shallow. Narcissistic is this kind of belief that you're special and this need for admiration from people, and it's hard for them they lack empathy because they're so self-absorbed. Cluster C includes people who often appear anxious or fearful. Avoidant types, they're socially inhibited because they feel inadequate, and they're hypersensitive to being negatively evaluated by people. And then there's some dependent, this kind of excessive need to be taken care of, or and it leads to this kind of submissive, clinging behavior because they're always afraid of being abandoned or left. and obsessive compulsive, this kind of preoccupation with orderliness and perfectionism, and a real kind of inflexibility. Sometimes we see a little bit of ourselves in a number of these, but and that's common, but it doesn't mean that that we have these disorders. Again, you have to have a certain number of symptoms, and they would have to be really a fairly pervasive and maladaptive part of your personality. By example of that, antisocial personality is one, and as you can see here, to get this, you need 3 or more symptoms. It can be any of these, but it's this pattern of disregard or the violation of rights of others occurring since 15, and so and there's a lot of different ways you can be diagnosed with this. So failing to conform to social norms, or you're unlawful, you're deceitful, impulsive, irritable, reckless, irresponsible, lack of remorse, and you have to actually have evidence of something called conduct disorder when you're in childhood. So it gives you an idea of what the specific criteria for one personality disorder would look like. And then the others all have similar symptoms where you would have to reach a certain number of these to be diagnosed. All right, that's just a funny little picture of a man with a tattoo, and that's it for today. Thanks, bye.